I'm Anthony Parrino. I'm a hand, wrist, and elbow surgeon at University of Connecticut in Farmington, Connecticut.
Awesome. When did you choose to go into hand surgery and how did you make that decision?
Sure. So I think probably pretty commonly going into orthopedics, I had a sports background. I was a pitcher, had shoulder injury, so that was my interest in orthopedics. I thought I was going to do sports going into it, and then actually my first rotation was with yourself and Dr. Rodner. And I really enjoyed the cases. They were, a lot of bread and butter cases, but cases that were also unique that weren't seen that often. And I got to treat patients from children to elderly, fractures, tendon care, anything in between. And I kept an open mind through my next 2 years, and I really kept gravitating towards hand surgery, and I made the right decision.
Awesome.
Yeah.
If you had to pick a mentor, who'd be your one mentor?
Yeah. So I think this is a tough one. So I'll give you one, but I would say I definitely had lots of mentors at different stages. For sure, yourself and Dr. Rodner and helping me, choose the right path towards hand surgery. But I think, then going to fellowship and, seeing all the cases that I haven't seen and how much I didn't know and thinking things through. And, even afterwards, I had great mentors there with, Ron Gonzalez and John Elfar and Warren Hammert. But I go back to Dr. Hammert. He's the guy I call if, especially that first year or two out of fellowship. Dr. Hammert, what do you think about this? And he's always so calm and straightforward and matter of fact, and like nothing phases him. And he knows everything, but he's has no ego. He's down to earth, and he has a great sense of humor. I remember I was on his first couple of months I was with him, and I couldn't tell if he actually liked me or not. But he did apparently, and we keep in touch quite frequently. And he's been great to always talk to now. Just seeing how things are as he's moved on from Rochester down to Duke.